Hi there, Mom and Dad. Let's talk about food allergy. Meron bang allergy sa pagkain yung bata mo? Nagkaroon ba ng rash, itching? Well, you're in luck. In today's Ask Me Anything episode, I will answer your top 10 most common questions on food allergy. Before anything else, I'm Dr. Kristine Alba Kiat. I'm a board certified pediatrician, and my mission is to empower you, moms and dads, so you can raise happy and healthy kids. Now, let's get started. First question, what is a food allergy? So, ano ba ang food allergy? Food allergy happens when our body's immune system na mistake yung food as harmful. That is why nagtitrigger yung body ng allergic reaction. Pwedeng magkaroon ng symptoms after this allergic reaction. It can range from mild symptoms kagaya ng rash or itching, or pwede ring maging severe ang allergic reaction kagaya ng anaphylaxis, or you may difficulty of breathing na yung bata. Okay, number 2 question, and an important question. What are the most common food allergens in children? So let's enumerate. The top allergens can be from milk, eggs, peanuts, tree nuts like almonds and walnuts, also soy, wheat, fish, and shellfish. Okay, number 3 question. What are the symptoms of a food allergy? So, a food allergy can appear minutes immediately after eating, and ang signs and symptoms may include hives, itching, or a specific skin rash. Pwede rin magkaroon ng swelling or pamamaga ng lips, tongue, and face. Also, may respiratory symptoms kagaya ng magkaroon ng difficulty of breathing or a wheezing sound that we hear. Pwede rin gastrointestinal ang symptoms or coming from the tummy, where the child can have vomiting or diarrhea or tummy pain. And a severe reaction, which is called anaphylaxis. It is a life-threatening reaction that needs immediate attention. Okay, number 4. What is anaphylaxis? Let's go to that. And how is it treated? Well, anaphylaxis ay severe type of reaction, and it can cause difficulty of breathing, swelling of the airways, and pwede rin magkaroon ng drop in blood pressure. This requires immediate attention. If your child has an EpiPen, administer it immediately and go to the emergency room immediately if this happens. Number 5 question. How are food allergies diagnosed? Okay, the doctor can diagnose a food allergy by getting a complete medical history and examining your child. So, for signs and symptoms and checking the triggers of the allergic reaction. Your child can also be diagnosed with food allergy by a skin prick test. So, how does it go? So, a small amounts of allergens are placed on the skin of your child, and a reaction to it will be checked. Also, a blood test can be done to check for allergy related increase in antibodies. Or, meron din, lastly, oral food challenges, which is supervised by the doctor. A food is introduced in a medical setting and the child is checked for an allergic reaction. Okay, number 6. How can I manage my child's food allergy? Yes, this is an important question. The first treatment food allergy is, of course, avoid the allergen. Once you've discovered that your child is allergic to that substance, do not and avoid giving it to your child. And educate your child which foods are safe. Also, if your child carries a risk of a severe reaction, it is important that you should always have an EpiPen at home and in school, or your child can bring it with him or her. You should also educate caregivers and teachers, daycare staff, on how to handle an allergic reaction when this happens to your child. Okay, number 7 question. Can my child outgrow a food allergy? Yes, there are some food allergies that are outgrown by kids as they go to school age. These allergies to milk, eggs, and soy can be outgrown. But allergies to peanuts, tree nuts like almonds and walnuts, and shellfish, these are less likely to be outgrown. Okay, number 8 question. What should I do if my child has a reaction? So, if your child has an allergic reaction, administer the EpiPen immediately, especially if the reaction is severe or the child has difficulty of breathing. Then bring the child to the emergency room. Call 911 and go to the nearest ER. If the symptoms are mild, like a rash or itching, you can give antihistamines and monitor your child closely, baka magkaroon ng worsening symptoms. Okay, number 9. Can food allergies be prevented? Well, some school of thought would recommend introducing solid foods that may be allergens early, like 4, 5, or 6 months. Peanuts and eggs can be introduced around 4 to 6 months of age and may reduce the risk of developing food allergy. But it is best you discuss this with your pediatrician first. Another tip for you, exclusive breastfeeding. So, if you exclusively breastfed for 4 to 6 months, this may offer some protection against allergies. Okay, number 10 question. What is the difference between food allergy and food intolerance? Okay, a food allergy is an allergic reaction where the body's immune system is involved. Pwede magkaroon ng severe reaction kagaya ng anaphylaxis which we talked about. Pero there is a condition known as food intolerance. Hindi involve ang immune system. This is typically gastrointestinal or digestive ang issue where the child may have some bloating, gassiness, or diarrhea. An example is lactose intolerance. Okay, if you have further questions, you can type in the comments below and I'll get back to you. If you enjoyed this video, how about you watch my next video where I teach you about other child health problems.